First of all, I must say what a joy it is to see the exciting research that has so far been presented that's going on in our state. It's really great at all levels, from the molecular to the surgical suite. So here I'm going to talk a little bit about work that's been going on for nearly 20 years. Madeline Lenski has played a very big role in it. It's the ELGAN study, ELGAN standing for Extremely Low Gestational Age Newborns. And it was a study begun in the early 2000s. We enrolled 1,500 plus newborns, all born 3 months early, less than 28 weeks of gestation, in 14 hospitals in 11 cities in 5 states. And they've been followed at age 2, 10, 15, and now in the field at 17. Just to point out, you see the map there, the 3 Michigan hospitals were Beaumont, Sparrow, and Helen DeVos Children's Hospital. We were part of a Midwest hub of the study. There was a New England hub, as you can see, and a North Carolina hub. So we had 3 rounds of follow-up, birth and really age 2. We followed them to age 2 with 92% seen. And then at age 10, and even of the eligibles, because it was a subset, we didn't actually follow absolutely everyone. We were able to see 92%. And then at age 15, that's been done, and age 17 is now in the field. And Madeline Lenski directs our local Sparrow Hospital program and has been involved with Sparrow, as I said, since the with ELGAN since the beginning. We just actually published a summary of a lot of the results from age 2 and age 10. Doesn't include the age 15 results as yet, with my colleagues Olaf Daman and Alan Leviton of Boston and Mike O'Shea of North Carolina. And that kind of tries to summarize a lot of the stuff about the ELGAN study, which looked at not just at cerebral palsy, but at lots of forms of neurodevelopment. I should say this little baby pictured in 4 photos on the front cover was born at 22 weeks of gestation and is doing extremely well now. Wonderful, optimistic story. So the ELGAN context is this is a subgroup of babies who are at very high risk of perinatal brain damage and of several kinds of developmental disabilities. And just to show you in our ELGAN cohort what the relative risks were for disability compared to published data on term-born infants, you can see that the relative risk of having a low IQ is increased 11-fold, epilepsy 7-fold, autism spectrum disorder 4-fold, attention deficit disorder 4-fold. But the one that really is dramatically raised in risk is cerebral palsy. 37-fold in our data compared to published rates. 11% of our ELGAN babies had cerebral palsy. And we had a careful algorithm for the diagnosis, which I think was very reliable, developed by Carl Kuban, actually, the child neurologist in Boston. So something we confirmed in ELGAN, it had been known before, but like a lot of things that are known before, not always well absorbed by the clinical universe, which is what is the brain damage that actually causes the trouble? And to a large extent, what it is what we call white matter damage. The white matter is that part of the brain which it looks white, not at this time in utero, not even when preemies are born, but later in life when the axons are myelinated, and the gray matter represents the cell bodies, the white matter represents these long projections of the cells which are transmitting impulses called the axons. And we see damage in that part of the brain in a couple of forms. Echolucent lesions that look like kind of missing neurological tissue in the brain. You see it on the left, there's ultrasound pictures, or sometimes they come in multiple echolucent cysts or cavities, technically speaking, and also enlargement of the ventricles, which also represents loss of white matter. And those 3 forms of white matter loss are are really key to the risk that babies experience, and they're really important targets for prevention. Now, there are 2 other brain lesions which are very common in preemies, germinal matrix and intraventricular hemorrhage, and they get talked about a lot, but in fact, they actually don't raise the risk of disability much. And one of the messages we've been trying to get out through ELGAN and other studies is to focus on the white matter damage and not so much on the hemorrhagic lesions. And that hasn't quite yet fully penetrated the pediatric universe. So just to show you the results of what we found in ELGAN, which, as I say, reinforces the findings of earlier studies. If you had no white matter damage at all in ELGAN, you were in ELGAN, with or without intraventricular hemorrhage, your risk of having cerebral palsy was between 6 and 7% or something like that. But if you had white matter damage present, either with or without a hemorrhagic lesion, the risk was nearly a half. And in fact, the relative risk, of course, is just increased by about 8-fold when you had white matter damage. And in fact, it accounts for, interestingly enough, the data are kind of interesting, precisely half of the children with CP had white matter damage. The other half come in the larger fraction. White matter damage is not desperately common, found in about 6 or 7 or maybe 10% of babies of this gestational age, but they managed to account for half of the kids with CP. The other half don't have evidence of white matter damage. And one of the big questions we have is, okay, what's happening with them? Is it something we can't see quite yet? Is it too subtle? We have pathological evidence and other evidence that suggests that might be the case, that there are forms of white matter damage we just aren't able to visualize on the ultrasounds that we use in babies. And just for interest, it really, the fraction of the babies who had either quadriplegic 4 limbs involved, the lower limbs involved, or one side involved, really didn't differ very much by the kind of white matter damage. It was about a 60-20-20 split. Maybe PVL was a little more pushed towards diplegia, but by and large, it didn't change very much the kind of white matter damage we saw, the kind of cerebral palsy we saw. Now, putting together this, I'm sorry, I've got to go backwards. Let's see if this will work. Yes. What ELGAN pioneered was the idea of doing some molecular explorations in the newborn blood and also in the placenta to see if it could work out a particular issue in perinatal brain damage, which is the importance of inflammation. And that's been discussed already a little bit by Sakine, and I think Sid touched on it a bit as well. It's not just hypoxia and ischemia, although that is important. It could be other factors. And we think that there are both factors that you can measure in the blood that are promote cerebral palsy, and also ones that are growth factors and that prevent cerebral palsy. I cannot show you any of the latter data right now. It's incomplete for the cerebral palsy analyses. It's been done for some other outcomes. Steve Korzenowski has actually been very involved in that in our work in ELGAN. But we wanted that the major purpose of ELGAN, the study which we found was called Molecular Antecedents of Perinatal Brain Damage in Extremely Low Gestational Age Newborns. We're trying to work that out, and I'll show you some of those results, some of which are actually hot off the press. So the first thing I'll say is, what about inflammation in the placenta prenatal before the baby is born? And we looked at chorioamnionitis, which is infection of the placenta, both on the maternal side and on the fetal side. And we described it by stage and by grade, whether early, moderate, or advanced, or severe, mild, or moderate. And here are some of the results. It seems like the most advanced forms of inflammation, be they on the maternal side or the fetal side, pretty much doubled the risk of having cerebral palsy by themselves. So an important effect, but not a dramatic effect. These, by the way, are adjusted for many, many other variables, as you can see in the slide. Then we paid a lot of attention to measuring proteins in the newborn blood. And the blood was collected whenever, as you know, these tiny babies are in the hospital, they're very sick, they have lots of blood taken lots of times. And we collected little drops when they were having a test for something else and put it on filter paper. We did focus on the first few days at around the 7th day and around the 14th day. We measured at least 25 proteins. Actually, we measured more, but 25 kind of turned out to be important. We worked with Reina Fucharova, fantastic biologist at and pregnancy immunologist at the Harvard and Brigham and Women's Hospital, and was able to measure these things on tiny drops of blood, all these proteins. And we measured both the pro and anti-inflammatory proteins as well as growth promoters. So these are some of the items that probably the more significant ones we looked at. People who work on the basic science end of things will recognize some of these key proteins. And I'm going to show you some results of some of them. Interestingly enough, I don't think we got into the protein that Sakeen talked about. We'll have to maybe redo all our results and see what we can find. We come back to that. What was interesting is it turned out to be not in our hands, not just one protein measured at one point, but what really seemed to matter was having a lot of different anti-inflammatory, pro-inflammatory proteins measured persistently. In other words, they didn't just occur once, but they occurred in at least two of the measurements, 2 out of the 3 measurements we took at least a couple of weeks apart. And you see if we found 2 to 3 or 4 to 5, but as you, there was some effect, but as you get up to having more than 6 to 8, more than 9 proteins, we get up to relative risk of about 3. And then of course, there was also the fact that these proteins often represent different pro-inflammatory systems. They're cytokines, they're chemokines, they're adhesion molecules, and so forth. And we divided them into 5 systems, and we said, how many systems are involved in the proteins? And again, the risk increases by the number of systems involved that are being elevated. So sustained and multimodal inflammation is what gives you the relative risks around 3 and 4 of having cerebral palsy in the newborn period. Now, this is quite a recent thing, just, oh no, this is actually from 2017. The question we had is, what if you had the combination of placental inflammation and some key postnatal inflammation? As you can see, that spastic diplegia in particular, if you had both placental inflammation and TNF alpha elevated or IL-8 elevated, a little less with ICAM1, you start to see 4 to 5 times the risk of cerebral palsy. So we see an interaction where placental inflammation, postnatal inflammation are contributing to the overall risk, and particularly for diplegia, a little less so, but also significantly so for quadriplegia. So just summarize, ELGAN reinforced what we had known before, that white matter damage imaged by ultrasound is the single most important predictor of cerebral palsy in ELGANs. It elevates the risks nearly 10-fold. Half of kids with CP who were born under 28 weeks had a white matter lesion. And we can assess inflammation in the perinatal period, both in the placenta and postnatally in the blood, in infants' serum. And both convey information about the risk of cerebral palsy. And the risk increases when elevations of multiple proteins are persistent and multiple classes are involved. And finally, that there seems to be an interaction with an increased effect on risk of cerebral palsy if you have both placental inflammation and postnatal inflammation. So thanks very much. Happy to talk to you to answer questions.
Thank you, Nigel. That was great. I'm wondering about maternal genotypes. You know, we used to talk a little bit about mothers with metabolic syndrome being at higher risk for having cerebral palsy. That's an inflammatory state. What do we know about that?
We have found in ELGAN a risk relationship between maternal obesity and cerebral palsy, just unadjusted for anything. Whether that is mediated by inflammation, we suspect it might. Definitely women who are, or anybody who is obese has a somewhat of a pro-inflammatory state. Whether that obesity is of genetic or environmental origin, I think it doesn't really matter. So we have some of those risk factors looked at. We have not, I don't think we've done much exploration of the genome in ELGAN. That remains open to interested investigators, you know, who might want to come in with us. I think right now there's a lot of emphasis now. Mike O'Shea at North Carolina is looking at epigenetics, the changes in the DNA in utero and in the placenta especially that might convey risk information about cerebral palsy and other disabilities.
That's great. And then Sid asked a question about MRIs, and Madeline answered that you have MRIs age 15 and a subsample at age 10.
Right. We have started to collect them, and we should be beginning to analyze some of those data soon. Yeah, but I think the immediate information at the birth is what I focused on here. That you can get with ultrasound. It's not very easy to get MRIs on very sick newborns, as you know.
Yep. Nigel, thank you so much.